But when I was an intern at the University of Wisconsin, one of my first rotations was on the hematology service, and I got to sort of see, the other side of the coin, so to speak. Got to be in the clinic a little bit, and my background is in molecular biology, so I'm really interested in, changes in DNA and mutations, and it seemed like to me that hematology and oncology was really at the forefront of developing, new treatments based on those changes. It's really at the forefront of personalized medicine, and so that's how I got into hematology and oncology. Cancer is not a one-size-fits-all diagnosis. Everyone is an individual. Their cancer is individual to that person, and so really the way that medicine is going, and really in particular oncology, is to personalize treatments to the patient and the patient's cancer, and that really means getting down to the molecular level, looking at the DNA, looking at the changes that drive the development of the cancer, and targeting those treatments to that. Our biggest positive is that we care about the patient first. We're a very compassionate group, I think. We know that a cancer diagnosis is a life-changing thing, and our focus is to be on the patient, but the whole patient. We try to make people as comfortable as they can. Our whole staff is focused on the patient and treating them as a whole, not just treating them as a cancer diagnosis. The other thing I think that's a little bit unique to us is that we're very collaborative. We discuss all the patients frequently with our other colleagues, and so oftentimes it's not like you're just being treated by one physician. There's input from all the physicians. As a doctor, it's easy to get lost in the medicine because you go to medical school and that's what they teach you. There's just so much to learn that the focus is on the medical issues, and so it's easy to get lost in that and lose sight of the patient and the patient's family and what they're going through. And really, as a physician, I think our job is, as you say, to be an advocate for the patient, to do the right thing for the patient, whether that's medically or something else. And that's something that personally is very important to me, and I think our whole team and our whole philosophy is built around that, is doing the right thing for the patient, not only medically but otherwise.